Doctor, I'm worried about this rash on my leg. It's red, swollen, and feels hot to the touch. It's even starting to blister in some areas.
I understand your concern, Mr. Smith. Tell me, when did you first notice this rash?
Just a couple of days ago. It started as a small red area, but it spread quite quickly. My leg feels tight and painful, and I've been feeling a bit feverish and unwell.
Dr. Jones carefully examined the rash, noting its distinct raised border and the surrounding inflammation. Based on Mr. Smith's symptoms and the appearance of the rash, Dr. Jones suspected a common but potentially serious skin infection called erysipelas.
Mr. Smith, based on your symptoms and the examination, it appears you may have a skin infection called erysipelas. This condition is characterized by a sudden onset of symptoms, including fever, chills, and a red, swollen area on your skin that feels warm and tender to the touch. It's a type of cellulitis but more superficial, affecting the upper layers of the skin. It's important to remember that this is just a preliminary assessment and we'll need to run some tests to confirm the diagnosis. These tests might include a blood test to check for signs of infection or a skin biopsy to identify the specific bacteria causing the infection.
Erysipelas is a bacterial skin infection usually caused by Streptococcus bacteria. These bacteria are commonly found on the skin and in the throat, and they can become problematic when they enter the body through a break in the skin. These bacteria can enter the skin through cuts, insect bites, or other breaks in the skin's protective barrier. Even minor injuries, such as a scratch or an insect bite, can provide an entry point for the bacteria. Once inside, they multiply rapidly, leading to the characteristic redness, swelling, and pain associated with erysipelas. The affected area may also develop blisters, and the edges of the infection are often raised and sharply demarcated from the surrounding skin.
The good news is that erysipelas is treatable with antibiotics. The type of antibiotic prescribed will depend on the severity of the infection and the patient's overall health. In most cases, oral antibiotics are sufficient, but severe infections may require intravenous antibiotics. However, it's crucial to begin treatment promptly to prevent potential complications. If left untreated, erysipelas can lead to serious health issues, such as abscesses, blood infections, or even the spread of the infection to deeper layers of the skin and other parts of the body.
Mr. Smith listened intently, absorbing the information. He understood the importance of following the treatment plan and attending follow-up appointments to ensure the infection was fully resolved. He was relieved to know that the infection was treatable, but also concerned about the potential complications Dr. Jones had mentioned. He asked about ways to prevent future infections, and Dr. Jones advised him to keep his skin clean and moisturized, avoid scratching or picking at the skin, and promptly treat any cuts or insect bites to reduce the risk of infection.
What kind of complications can occur if erysipelas is left untreated?
Untreated erysipelas could lead to serious health problems. The infection could spread to deeper layers of the skin and underlying tissues, causing abscesses or cellulitis, a more widespread skin infection. In rare cases, the bacteria could even enter the bloodstream, leading to a life-threatening condition called sepsis. Other potential complications include lymphedema, a condition that causes swelling in the arms or legs, and recurring episodes of erysipelas. These complications are more likely to occur in individuals with weakened immune systems or underlying health conditions.
Mr. Smith's concern deepened as he realized the potential seriousness of his condition. He was grateful that he had sought medical attention promptly and was determined to follow Dr. Jones's recommendations closely.
Don't worry, Mr. Smith, with prompt treatment we can effectively manage your condition and prevent these complications. It's important to address this early to avoid any further issues. We have a comprehensive plan in place that will help you recover swiftly and get back to your normal routine. The first step is to confirm the diagnosis, and then we'll start you on a course of antibiotics. These antibiotics are specifically chosen to target the bacteria causing your infection. We'll monitor your progress closely to ensure the treatment is working as expected.
Dr. Jones explained that the antibiotics would target the bacteria causing the infection, reducing inflammation and promoting healing. He also mentioned that it's crucial to follow the dosage instructions carefully to maximize the effectiveness of the treatment. He emphasized the importance of completing the full course of antibiotics as prescribed, even if Mr. Smith started feeling better before finishing all the medication. Stopping the medication early could lead to a resurgence of the infection, which might be harder to treat.
In the meantime, you can apply cool compresses to the affected area to help reduce swelling and pain. This simple home remedy can provide significant relief and help manage the symptoms while the antibiotics take effect. Over-the-counter pain relievers like ibuprofen or acetaminophen can also help alleviate discomfort. These medications can reduce pain and inflammation, making it easier for you to go about your daily activities without too much discomfort.
Mr. Smith felt a wave of relief wash over him. Knowing that there was a clear plan and effective treatment available gave him a sense of control over his health situation. He was glad to know that effective treatment was available and that he could take steps to manage his symptoms while waiting for the antibiotics to take effect. He decided to educate himself further by reading medical pamphlets and researching online, ensuring he was well informed about his condition and the treatment process. This proactive approach helped him feel more confident and optimistic about his recovery.
To confirm the diagnosis and rule out other possibilities, I'd like to run a few tests. These tests are crucial in ensuring that we have a comprehensive understanding of your condition. By doing so, we can pinpoint the exact cause of your symptoms and eliminate any other potential issues that might be contributing to your discomfort. These will help us determine the best course of treatment. It's important to approach this methodically, as the right treatment can significantly improve your quality of life. We want to make sure that we are addressing the root cause of the problem, not just the symptoms.
First, Dr. Jones would take a swab of the infected area to send to the lab for culture. This step is essential because it allows us to identify the specific bacteria or pathogen responsible for the infection. By knowing exactly what we're dealing with, we can choose the most effective treatment. This test would identify the specific bacteria causing the infection and determine the most effective antibiotics. The lab analysis is thorough and precise, ensuring that we don't miss any critical details. This way, we can avoid using broad-spectrum antibiotics and instead use a targeted approach. He would also order a blood test to check for signs of infection and inflammation. Blood tests are a vital part of the diagnostic process because they provide a wealth of information about your overall health. They can reveal markers of infection, inflammation, and other underlying conditions that might be affecting your health.
The blood test involves a simple blood draw, and the results will be available within a day or two. This quick turnaround is beneficial because it allows us to move forward with your treatment plan without unnecessary delays. The sooner we have the results, the sooner we can start addressing your condition effectively. Once we have the results, we can tailor the treatment plan to your specific needs. Personalized treatment plans are crucial because they take into account your unique medical history, current health status, and specific condition. This ensures that you receive the most effective and appropriate care.
Mr. Smith understood the importance of the tests and was eager to begin the treatment process. He appreciated the thorough explanation provided by Dr. Jones and felt confident in the proposed plan. Understanding the purpose and benefits of each test helped alleviate his concerns and made him more comfortable with the process. He felt reassured by Dr. Jones's thoroughness and expertise. Knowing that he was in capable hands gave him peace of mind. Dr. Jones's approach not only focused on the medical aspects, but also on ensuring that Mr. Smith felt supported and informed throughout the entire process. This holistic approach to patient care is what makes a significant difference in the overall treatment experience.
While we focus on treating your current infection, Mr. Smith, it's essential to discuss preventive measures to reduce the risk of recurrence. Maintaining good hygiene is very important. Washing hands frequently with soap and water, especially after touching the affected area, is crucial. Also, keep the infected area clean and dry. Avoid scratching or picking at the rash, as this could introduce more bacteria and worsen the infection. If you have any cuts or wounds, clean them promptly and thoroughly with soap and water. Applying an over-the-counter antibiotic ointment can also help prevent infection.
Got it, Dr. Jones. I'll make sure to follow these steps. Thank you, Dr. Jones. I feel much better knowing what's wrong and that effective treatment is available. I'll make sure to follow your instructions carefully.
You're very welcome, Mr. Smith. Remember, early detection and treatment are key to a positive outcome. Don't hesitate to reach out if you have any questions or concerns.
Mr. Smith left the doctor's office feeling empowered and optimistic about his recovery. He was grateful for Dr. Jones's expertise and compassionate care, and was determined to take charge of his health. Mr. Smith's experience highlighted the importance of seeking medical attention promptly for any unusual skin rashes or infections. While erysipelas is a treatable condition, early diagnosis and treatment are crucial to prevent potential complications. Delaying medical care can allow the infection to spread and worsen, increasing the risk of serious health problems. If you notice a red, swollen, and painful rash on your skin, especially if it's accompanied by fever or other symptoms, it's essential to consult a healthcare professional without delay. Remember, your health is your most valuable asset. Don't hesitate to seek medical advice if you have any concerns. Understanding erysipelas and its causes, symptoms, and treatment is essential for protecting your health. By following preventive measures such as maintaining good hygiene and promptly treating cuts and wounds, you can significantly reduce your risk of developing this infection. If you do develop erysipelas, remember that effective treatment is available. By working closely with your healthcare provider and following their recommendations, you can overcome the infection and prevent long-term complications. Knowledge is power. By staying informed and taking proactive steps, you can live a long, healthy, and fulfilling life.